Good morning, Washington. Happy Thursday, and thank you for attending our monthly housing topical webinar. Today we're going to be covering the Trueblood Settlement. We haven't had an opportunity yet to really get into the fine details of this, and we're glad to have an opportunity to speak with you. Today we have Melody Pazel and Ora MacArthur on the line with us to discuss this with us and give us a lot more rich details. I'll give you a brief overview. We're covering Trueblood, which is a case challenging unconstitutional delays in competency evaluation and, pardon me, my apologies, competency evaluation and restoration services. As a result of this case, the state has been ordered to provide court-ordered competency evaluations within 14 days and competency restoration services within 7 days. So I'm going to go ahead and pass this on to our wonderful Melody Pazel to give us more information and start our webinar. Thank you very much, Melody. Here you go.
Thanks, Amanda. Good morning, everyone. My name is Melody Pazel. I'm a section manager at the Healthcare Authority in the Division of Behavioral Health and Recovery, and I oversee the behavioral health programs and recovery support services. And my co-presenter, Ora MacArthur from the Department of Social and Health Services and the Behavioral Health Administration. She is the project manager, project director over all of the Trueblood Settlement projects. And so we're very glad to have Ora here this morning.
Thank you, Melody. I'm glad to be here too.
Before we get started and kind of launching into the information about the Trueblood Settlement, we, first want to level set and just remind folks that even though this settlement agreement and all of the resources that are coming as a result of this settlement agreement are for individuals with serious mental illness that have committed a crime, that is by and far a small percentage of individuals, and that it's really important that we continue to remind people that people with mental illness are far more likely to be victims of crimes than perpetrators, and that when individuals are in jails and prisons, we know from the research that almost half or over half of individuals in prison have experienced or reported experiencing childhood trauma. And so oftentimes the folks arrested in jails and the folks that we're talking about in the Trueblood Settlement have oftentimes been arrested for minor crimes, and homelessness being sort of crimes associated with homelessness are one of the more prevalent types of crimes. And so a lot of the things that we're going to be talking about in the Trueblood Settlement are also related to sort of the criminalization of homelessness and the criminalization of people with serious mental illness. We also know that from the data that people that are homeless are more likely to be African American or Native American and have serious mental illness and substance use problems and complex issues such as chronic health conditions. And so this is certainly, this settlement agreement is certainly an opportunity to address some of these issues, these larger systemic issues that we're seeing with disparate populations. And so keep that in mind as we talk about the settlement agreement and all of the projects that are associated with the settlement agreement to try and not only address those folks that are currently in jail, but also try and divert people from ever being arrested in the first place. So, Ora, I'm going to turn it over to you to talk just a little bit about the history of the Trueblood Settlement.
Thank you very much, Melody. So for those of you that aren't familiar with the Trueblood case, it's a class action lawsuit. And as Melody mentioned earlier, it's because of the time frame. So by law, we're required to provide evaluations within 14 days and restoration within 7 days. And Washington had consistently been missing those deadlines. There were folks that were oftentimes sitting in jail for much, much longer. And there were a lot of bottlenecks in the system. There was a class action lawsuit that was brought, and rightly so, Washington lost. So Washington started working on, Department of Social and Health Services specifically, started working on trying to fix the bottlenecks and meet those timeframes that are required. And they thought they had a handle on the problem. They thought, well, we'll just add more beds. And if we add more beds and we add more evaluators, we'll be able to provide competency evaluation and restoration timely, and everything will continue on the way that it should be. And so they started down this path of adding beds and adding evaluators, and that didn't resolve the problem. There was a large spike in evaluations that were being ordered and restorations that were being ordered, and they weren't really sure why. So I'm trying to keep it high level, but if there's questions about this, please let me know. They started, I think it was around 2015, and then they went through, you can see here on the slide, I don't want to read it for you, but the end result was that things actually got worse instead of better. Times actually got worse instead of better, and that was when contempt of court was found. And it was then that Department of Social and Health Services started talking to Disability Rights Washington about a settlement agreement. And so this screen shows, Melody, if you could go back one screen. Thank you. So Trueblood, a lot of people believe that Trueblood is the name of one of the defendants, and it's actually a friend of one of the defendants who brought forward the first case. And go ahead and go to the next slide. So thank you. So this shows a graphic of jail-based evaluations and inpatient evaluations. Those are the two kinds of evaluation orders that can be entered. And you can see that there was kind of a predictable, I think it was around 10% increase. That was pretty standard based on population increases and things like that. And then right around 2015, there was this large uptick that's continued even to this day. If you were able to see the 2019 line, what we have so far, it's continuing in that general uptick, much higher than previous years. So the state and other groups started doing studies. We have an internal research and data analysis group that started studying the problem, trying to identify what was it that was at the root cause of this dramatic increase. We also hired people to do, specialists and experts to do research from outside, to come in and look at and help us figure out this problem. And the end result was we had a lot of people look at this issue, and no one was really able to identify a specific root cause or even a cross base of root causes that led to this uptick. And so, part of the thing that I want to say with the settlement agreement is this is not meant to be a magic bullet. That there's a lot of things in the settlement agreement that people truly believe will make a difference, but there's not an expectation that even if everything that's implemented in the settlement agreement is done perfectly, that it's going to resolve the full problem. And part of that is because we have not yet been able to identify the root causes of the general uptick. It's not related to homelessness increases in population. It's not related to general population increases. It's not related to an increase in people being diagnosed with mental health illness or with substance abuse disorders. They looked at all of these different factors and they couldn't tie it to any particular factor. So if you'll go to the next slide. So this, Melody, did you want to take over here and talk about the evaluation process?
Sure. So, when an individual is picked up for a crime, they go to court and charges are filed against that person. And so when they go to court, whether or not they can participate in their own defense is the whole crux of the competency evaluation and restoration process. It's not whether or not they are symptom-free. It is all really about whether or not they can participate in their own defense. And so the court can essentially request a competency evaluation. So that court then basically says, we want this, either maybe the defense attorney or the prosecuting attorney or the judge is questioning whether or not that person can participate in their own defense. So the competency evaluation is ordered, and DSHS has a number of evaluators that they have hired to do that evaluation. And so that's the first kind of time clock that starts ticking, is that there's a certain amount of time that we have to be able to get those competency evaluations completed. It goes back to the court, and whether or not that person is competent to stand trial, whether or not they can participate in their own defense If they are, then they go to trial. If they are not competent, the only options really at this time are to do inpatient competency restoration, and that is only done currently, or before the lawsuit, was only done at Eastern and Western State Hospital. As a result of the lawsuit, DSHS tried to expand those inpatient beds because everybody knows that it's very difficult to get into Eastern and Western State Hospital. There was a significant backlog of beds, and so DSHS tried to expand the number of beds, as Ora said earlier, and so they created two facilities, one in Maple Lane, which is an old juvenile prison, and then another facility in Yakima. So in an attempt to try and meet that other deadline of how do we get folks into those inpatient beds, and so inpatient competency restoration. And inpatient competency restoration is really sort of these classes that teach a person how to participate in their own defense, coupled with treatment. And so that's really what inpatient competency restoration consists of. Then once they go through those classes, go through some treatment, then they're reevaluated on whether or not their competency is restored. And then that, if their competency is restored, they can go back to trial, or potentially the prosecutor or the judge could dismiss the case. So that it could be that person still ends up back in jail because they've been now convicted of a crime. Or there could be the potentially of the charges being dropped, or that person maybe needs longer term treatment. And so that could then be what we call a forensic flip, where that person is then determined civilly that they're not they're a danger to themselves or others, or gravely disabled, and so then they would go into the civil commitment. And so there's lots of different pathways, but what's really important to know is that the wait to get into those inpatient beds was taking much longer than if that person actually would have pled guilty and just served their time. And so that's the other sort of time clock that's ticking, is that access to those inpatient beds, that people oftentimes, even if they were determined not competent, they're waiting a very long time to get in access to those inpatient beds. Anything you want to add, Ora?
No.
So that leads us basically to the settlement agreement. So as Ora said, the DRW and the court and Washington State then started negotiating. Okay, what can we do? We've tried a number of things. We've tried more evaluators. We've tried more to increase our beds in our inpatient competency restoration beds. And so the next step was essentially let's come up with a settlement to try and get us out of the contempt fines. So the Washington State has been in contempt of court basically because we haven't been able to resolve these time frame issues. And so those contempt fines went into a kind of an account, and the court has been able to access those fines and been able to give some of those fines out through grants to do different pilot projects. Those pilot projects are very different and a completely separate bucket of funds than the settlement agreement that we're going to talk about that the legislature funded. So if you've heard about Trueblood projects, those projects are currently funded out of the contempt fines and monitored by the court and given out by the court, not by the state. So one of the things in the settlement agreement, one of the first strategies was, well, let's continue to try and increase the competency evaluators. Let's try and increase the number of people able to do those evaluations. And let's actually increase the inpatient restoration beds. One of the other points to mention is that those two facilities that DSHS and the Behavioral Health Administration and the Office of Forensic Mental Health Services did in the Maple Lane and Yakima, unfortunately, the court really saw those facilities not as a hospital, but really more just an extension of a jail. And so the court really is asking that the state transition those facilities, close those facilities down, and actually increase the beds at Eastern and Western State Hospital. And so one of the projects in the settlement agreement is that transition and increasing beds at Western and Eastern. And I think the Behavioral Health Administration just opened up a ward at Western State Hospital, what's fondly called as Building 127. And so that is in process, but there's more work to do as we transition, as the Behavioral Health Administration transitions Maple Lane and Yakima into these other. So these are two projects in the settlement agreement that have been funded by the legislature, and the Department of Social and Health Services and the Behavioral Health Administration and Office of Forensic Mental Health will be managing these projects.
Melody, if I could interject too. We have had, for those of you, I don't know how many people that are on the line are really closely tied to the budgets that come out and the information. And so these two projects were also where the funding started pre-settlement agreement. These were projects just like Building 27, which is a residential treatment facility, where in the midst of this several year-long process of lawsuit and contempt findings and all of that, they said, we know we need to do this. We know we want to do this. And so they were able to get support in the midst of all of the negotiation, in the midst of everything else going on. So we actually had funding that came out prior to this most recent budget for those two wards at Eastern and Western, and then additional funding during this budget session. So if anyone on the phone is familiar with that process or knew about that, that explains that piece of it.
Thanks, Aura. You'll also see, when you read the settlement agreement, and it is available online if anybody wants to go and have some late night reading and read the settlement agreement, it is posted on the DSHS website as well as Disability Rights Washington's website, and so it is available to read. When you read the settlement agreement, you'll see that it really is about this continuum, that there is a need to address those folks that are currently in jail that are considered the class members, that those folks that are waiting for those evaluations or waiting for that inpatient competency restoration bed. So those are what we call the class members, but the settlement agreement and the judge in the case is really about this continuum, not only about addressing the folks that are the class members, but trying to prevent future class members as well. And so you'll see as we talk about the projects in the settlement agreement that it is also about trying to actually prevent people from being arrested in the first place. And so we kind of see this as this continuum. And so this first part of the continuum is to really try and address that bottleneck, that pipeline that's happening within county jails for folks waiting for evaluations or waiting to get into an inpatient bed. So one of the strategies for those folks that are in jails waiting for those those inpatient beds is, could we actually do some of that inpatient competency restoration, those classes out in the community? So could we actually be able to do for those folks that have nonviolent felonies, that have misdemeanors, that maybe it's a shoplifting crime, maybe that person's homeless and disorganized and shoplift some food because they're hungry and go into jail and are not able to be competent to stand trial. And so those kinds of small misdemeanors or nonviolent felonies, could we actually do those classes in the community coupled with outpatient treatment? And so that idea was actually created in statute under Senate Bill 5444 that gave us the statutory authority to actually do some of those, what was previously only done in state hospitals or in Maple Lane or Yakima, in the community. And so that's what's going to be called outpatient competency restoration. And so we've received funding from the legislature to launch outpatient competency restoration and do that in partnership with the courts, with prosecutors, with communities, with jails, And so there's certainly a lot to do to set up this new way to serve individuals that have been, that are waiting that trial, that are waiting for that, that process. And part of the statute, part of Senate Bill 5444 also created this new service called a forensic navigator. So the forensic navigators are really agents of the court. So they are there to help that individual navigate the justice system, help them get connected to resources in the community and treatment. They are not clinical staff, however, they probably have backgrounds in clinical, but they're really agents of the court to help report back to make sure that person's going to those classes, make sure that that person's connected to treatment in the community, so that they can continue to, again, they still have to at some point have their disposition of their court case settled. And so the navigator is really that person to help not only report back to the court, but also help that individual. So with regards to these two projects, so the Behavioral Health Administration, DSHS, BHA, will actually be the ones that will hire the navigators. And then the Division of Behavioral Health and Recovery, the Healthcare Authority, will be actually contracting with community behavioral health agencies to conduct those outpatient competency restoration. So you're going to see throughout all of these settlement agreement projects that some of them are managed by Healthcare Authority, DBHR, and some are managed by DSHS, and that's we continue to have that very strong partnership, even though we are two separate state organizations now with the integration of behavioral health outpatient services. So think about it this way, pretty much anything that's inpatient or court is really managed by DSHS, and anything that's outpatient is really kind of managed by DBHR. So another project in the settlement agreement is that we know from the research that a lot of those folks that are sitting in jails waiting for that inpatient competency restoration bed also are homeless. And so we know that there's a very high prevalence of individuals that are struggling with housing or homeless, housing instability. And so in the settlement agreement, they talked about developing, using a model that the Division of Behavioral Health and Recovery has been using for a while called HARPS, Housing and Recovery Through Peer Services. And this is really a combination of supportive housing services and subsidies to help somebody obtain and maintain obtain and maintain their housing. And so we'll be using all sorts of different strategies with the goal of permanent supportive housing, but we also may be using, hotel motel vouchers so that that person is able to be successful in their outpatient competency restoration classes while trying to find permanent supportive housing. We know that there's a housing crisis. We'll be using, again, any and all kinds of strategies, whether it's shared housing, whether it's transitional housing, whether it's permanent supportive housing, with always the goal looking at permanent supportive housing. But we want to make sure that as somebody is going through their outpatient competency restoration classes, that they have a place to lay their head so that they're more likely to be successful in those classes and their outpatient treatment. So we'll be establishing 4 new HARPS programs within the 3 regions, and I'll talk about the 3 regions in a minute, that will be launching these projects in the settlement agreement. Again, trying to swim upstream a little bit and thinking about this continuum from trying to divert people from ever being arrested in the first place is how do we actually create more resources in our crisis mental health system. And so one of those strategies is to expand, enhance our crisis stabilization, crisis triage resources. If a police officer in the community encounters somebody that may have committed a small crime, could that police officer actually take that person to treatment instead of having to take them to jail? And so we want to give communities more options to serve those folks that may not be on that pathway. And so really looking at the opportunity to expand our crisis triage stabilization facilities to be able to take a more acute population. And we know that those folks still have to discharge from those crisis triage or stabilization facilities. And so we also have attached some emergency vouchers like motel, hotel vouchers to those crisis stabilization facilities so that they don't discharge somebody to the streets, that they could at least get that person into a hotel, motel while getting them connected to the HARPS program or other community resources like our foundational community supports, outpatient community mental health services, coordinated entry. All of those things will be part of that enhancement to the crisis stabilization facilities. We also want to bolster our mobile crisis services in communities, and so how to be able to help crisis programs within the 3 regions look at how can they increase their timeliness to respond to a suspected mental health, a person in a mental health crisis. And so so each community in our phase 1 implementation regions will be looking at developing that plan. What does a timely response look like? How do we make sure that those responders are going out into the community? So it's not just about going to the emergency rooms. And so what does that look like? So each community is going to tailor that to their community's needs. And we'll also have some resources then to be able to help them implement some of those strategies that they identify. The mobile crisis teams are also going to work very closely with another project called co-responders, and I'll talk about that in just a minute. This is probably one of the furthest swimming upstream strategies in the Trueblood Settlement, and it's essentially called intensive case management. However, for all you behavioral health folks, this is not the same kind of modality that we're talking about in our state plan on high intensive services. This is really about identifying individuals that have a history of being arrested, a history of competency evaluations, a history of inpatient mental health, a history of homelessness or unstable housing. And so research and data analysis, our partners over at DSHS will actually be creating a list of those individuals that have that history and that may really be potential to be a high utilizer of multiple systems or have that risk of potentially needing a competency evaluation in the future. And so that list will be actually generated, and we will actually have teams that will take that list and go out and try and locate those individuals, engage those individuals, as well as provide case management activities if they are in competency restoration services and not connected to a mental health service or working with a forensic navigator. And so we, under the intensive case management program, will be providing that support to help that person with accessing resources and services in the community. So we really see this a lot more like outreach and engagement, case finding, and being able to connect individuals to housing, connect them to resources in the community. So the intensive case management program will work very closely with the HARPS program to make sure that individuals that are on that list get access to housing. So all of these projects in the settlement agreement are all very much interconnected with each other, and we recognize that, but they're also all distinct projects that have been funded by the legislature. So throughout all of this project, we recognize that people with lived experience also need to be involved, and so we'll be looking at having people, certified peer counselors on our intensive case management, outreach and engagement teams. We will be having people with lived experience, certified peers on our HARPS program. They'll be connected to our outpatient competency restoration programs. And so people with lived experience and certified peers are interwoven throughout all of these projects, as is housing. And so part of the settlement agreement is to actually develop a continuing education curriculum for our certified peers. So we have a lot of certified peers throughout the state. We want to expand that. In fact, it's actually just, how to educate them on delivering peer services to individuals with justice involvement. And so we will have a program manager that will be developing this enhanced peer support curriculum, and we'll be delivering that throughout the next year to our certified peer counselors. So in addition to that, so the HARPS program, the outpatient competency restoration, the work on crisis triage and stabilization, the mobile crisis teams, the intensive case management, and the peer support are all projects that the Healthcare Authority and the Division of Behavioral Health and Recovery will be managing. Now we're going to switch gears just a little bit to another project in the settlement agreement, which is called the Co-Responder Program through the Washington State Association for Police Chiefs and Sheriffs. So WASPIC has been doing this pilot for some time, where they have a mental health professional that does ride-alongs with police officers, again with that intent of how could we try and divert someone from being arrested in the first place. And so the co-responder program will be enhanced through the projects, and we want to work very closely with our mobile crisis program as well as our crisis triage with the co-responder program. In addition to that, the Criminal Justice Training Center will be working at expanding crisis intervention training to jails as well as police officers throughout Washington State. And last but not least, another project in the settlement agreement is about expanding a behavioral health workforce. We know to do all of these projects, we need more behavioral health workforce. That I don't think that there's an agency across the state that hasn't said that they're having a challenge with hiring staff. And so we need to have more behavioral health workforce developed throughout all of these projects. And so DSHS and the Behavioral Health Administration also received some funds from the legislature to start looking at expanding behavioral health workforce development. And they'll be working closely with our efforts here at the Healthcare Authority. We also have some behavioral health workforce development strategies underway. And so we'll all be working really closely on all of those issues. In addition to that, there's also technical assistance to jails around all of these issues for those folks that may be in jail that are waiting those competency evaluations. So there's a lot of moving parts and a lot of projects in the settlement agreement. And so to do this would be a tremendous challenge to do this statewide. And so in the settlement agreement, it's really about kind of one phase at a time. So phase one is really about doing it in 3 regions, in the Pierce County region, the Southwest region, and the Spokane region. And so we'll be launching these projects starting July 1, 2019 through 2021, and then move to phase 2, which will be King County. And then phase 3, we'll be looking at what of these projects are successful, which ones are moving the needle, and then reevaluate to look at phase 3, which will be predominantly the rest of the state. Or anything you want to add?
Just one of the things I wanted to share is I'm sure one of the questions that people have, we've been hearing, is how did you come up with this list of projects? Like, where did all this stem from? And so some of you may have been involved. They did a lot of stakeholdering. Disability Rights Washington and Department of Social and Health Services traveled all around the state during the pre-negotiation and the negotiation phase of the settlement agreement to hear from people about where they saw the gaps, where they were concerned about resources. Housing was definitely one that came out in every single stakeholder session that they were in, and they used all of that feedback and all of that information to help craft what they were going to focus on during the settlement agreement. And so I don't know, some of the folks on the phone may have been able to participate in some of those stakeholder sessions that occurred.
So that's kind of an overview, and I really wanted the homeless community, our homeless safety net, our behavioral health housing and programs to kind of be aware of these new resources. One, there has been a pretty significant investment from the legislature on the HARPS program, those housing resources, and I think it's really a testament to say, I think the legislature really heard loud and clear the importance of housing to try and help address some of these challenges. And so when there's a lack of housing, that it could be impacting that we see more crimes around homelessness associated with homelessness. And so when you don't have those resources, it could impact more people in jails. And so I think that that has been really loud and clear, and that the settlement agreement has really helped bring that, I think, also to the forefront. And so it's a testament that the legislature and DRW and the court and GSHS sort of see the value and the importance of trying to help address homelessness and housing for individuals in the settlement agreement, whether they're the class action individuals or the class members, or whether they're those individuals that we're trying to prevent from being ever arrested in the first place. So I think that that's really important to state, and why we wanted to kind of bring this information to our homeless housing partners and our behavioral health agencies, so that you're aware of these new resources that are going to be coming into these regions to try and further address homelessness issues. So why don't we open it up to see if folks have any questions. So if folks either want to raise their hand, or Amanda, if you want to see if there's any questions that folks have. And
Sure. A handful of people asked if the PowerPoint would be made available, and I did respond and let people know that it would be available this afternoon, along with the link to the recording that's being made currently when we send it out, as well as multiple other links and resources that will be made available in the email. But so far, those are the only questions. Does anybody have questions for Aura or Melody concerning the Trueblood Settlement, or the process of putting it into play? Not seeing anything quite yet. Is there anything that either of you would like to add before, so maybe it would burn some questions?
It's a lot of information to absorb. The settlement is huge.
Really
it's got so many different components. It's overwhelming, even for those of us that are in the weeds on it every single day, because it's covering, as Melody showed in that visual, so many different parts of the stream of folks that could potentially become class members. And so we do have, an email address that I'd like to give out. So if people have questions now or later, if they want to be more connected to the work, if they want to be connected to folks that are working on this work to see if there's a way that they can participate or provide supports, please, I encourage everyone to send an email to this email box that I'm going to give, and then that email box is monitored by myself and the other project managers that are supporting all of the great staff across multiple agencies that are working to implement this, and we'll help you get connected with the right person. So you just need to send it to this one email, and we'll do the work for you of figuring out who the right person is to connect to. So the email is Trueblood, and that's TRUEBLOOD, Task Force, TASK Force, and it's all one word, at dshs.wa.gov.
It does look like we have a question, Melody and Aura. Julia asks, I have a question about discretionary funding for crisis stabilization services in ASO contracts. And that's what it states. And it says, how will there be stability for this service if ASOs are not required to pay for the service?
So our lead on that project is Keith Lewis, and he's working closely with communities. So we've gone and met with the three regions multiple times, and are having conversations with the BHASOs as well as with agencies that either operate ENTs or crisis triage or stabilization facilities, and really kind of taking a look at what would it take to actually fund crisis triage and stabilization centers, and to kind of evaluate the needs and whether or not we can increase the rates to be able to address those issues. And so we're right now we're kind of taking a look at all of those things and to see what would it take to be able to serve the needs of a more acute population and to be able to do those police drop-offs. And so that's kind of part of what we're doing right now. And absolutely, we are keeping in mind that not everyone has Medicaid, and so we also are looking into some of those strategies as well. And so, so that's definitely all part of what Keith is doing, as he's developing that plan around the community needs to address crisis services, as well as to increase the capacity for those crisis triage and stabilization facilities.
Okay, let's see. Why was the Southwest region chosen as part of Phase 1?
So there was a lot of discussion around which parts of the state to start this effort in. The goal was to have Phase 1 really be focused on learning, because some of these programs are brand new, have never been implemented, and they're very, they don't know that they're going to work the way that they think that they will. They think they're going to be successful, but we won't know until they're implemented. So they wanted to have a cross-section of both rural and urban areas. And they also looked at a lot of things, but they looked at how many competency evaluations and restorations came from each area, whether they had finished going through the integration process or not, because, people can get change fatigue. And so they wanted to make sure that they were able to increase the chances of success, not having a lot of different major initiatives going on at the same time. And so they had a lot of discussions during negotiation about what the right three regions were, and that's how they landed on Pierce and Southwest and Spokane.
Thank you, Aura.
You're welcome.
Kelsey Stedman has another question, and it's large. So, I work in a county that is not part of either of the two phases, but work in a program that could partner well with some of the intensive case management services. We work with HUs of ER, 911, and jail with mental health and substance use disorders. For the counties that are not in the first two phases, is there any opportunity for support in implementing any of these programs prior to 2023? And she says HU high utilizers.
So, Melody, did you want me to take that one, or did you want to take that one?
I'll let you.
So I think there's a lot of support. We've had a lot of conversations about how can we help the counties that want to proactively implement in their areas. I think the complexity for a lot of counties that aren't part of the Phase 1 regions is that they don't have the funding, right? So they don't have the same resources available to them. So I think, we can definitely get you connected with the leads of the different areas if it's the high utilizer program specifically. Whether the complexities of what that might look like or how much support they could offer or information they could share, that you'd have to work with each individual lead on that.
I think that there is, Aura was spot on. I think we are trying to, keep that in mind as we, have work groups to not only implement the projects in the settlement agreement, and just as an FYI, we actually have some really, really tight timelines with the court. So we are very much, we have what's called an implementation plan. That implementation plan is also available online. I have the DSHS website with links where you can read the settlement agreement as well as the implementation plan. I have access to the implementation plan, and so those projects which have really tight time frames, we are required to implement them in the phase 1 settlements, but we are also trying to think about, this is eventually potentially going to roll out across the state, and what does that look like? And so we're definitely trying to think of that, keep that in mind, but also just to be mindful that we have some really tight time frames in implementing these projects for the court. So lots of late night reading material, everything you want to know about Trueblood.
Yeah, I mean, the settlement agreement itself is, I believe, 54 pages, so it's, I don't think light reading is the right word, but
I think that might depend on who you're talking to.
A lot of legalese, for sure.
Yeah.
And Aura, Aura, can you maybe talk a little bit about the general advisory and
Absolutely.
the other?
Yeah, so part of the settlement agreement, there's a section of the settlement agreement that's totally focused on the governance. So for any of you who've worked with a major project, they usually will have a governance structure where implementation report outs and there's close monitoring and supports provided so that if people hit barriers or if there are problems, that they have this governance structure that helps either address barriers or provide direction or supports to achieve the ultimate outcomes of the projects. And so Trueblood is no different. There are two governance structures that were built into the settlement agreement. The first is an executive committee that's made up of folks from the Department of Social and Health Services, from Disability Rights Washington, from the Healthcare Authority, and also a person with lived experience. And they have the decision-making authority that is necessary to support governance of Trueblood. The second group is a general advisory committee. That group has not yet been stood up. The executive committee was stood up in January of this year, and we're looking at October, I'm sorry. I'm forgetting it's August and not July already. But the General Advisory Committee is set to begin to have their kickoff either in late September or early October. And that group is a much broader group. It's made up of both members of the executive committee and a lot of different organizations around the state that are either regionally focused in the regions that are in phase 1 or are broadly focused. So the Washington Defenders Association, the Association of Courts, jail members, behavioral health organization members. So the official list hasn't been released, so I can't share names, but they're getting very close to that. And there's been a process. They sent out a bunch of letters to different organizations asking them to send nominees in, and they're now in the midst of that evaluation of nominees. So that group is the one that will be the primary recipient of all the implementation report outs and is really that key connection to the communities and the regions and the different stakeholder groups and partners to get feedback from them about what's happening, how it's working, and to hear the report outs and to see the data that the different project teams are providing about implementation and what's happening, and to make recommendations that would go up to the executive committee and potentially from the executive committee to the federal court. So it's a very robust and multifaceted governance structure for this project because it is so large and there's so many different components and so many different agencies and organizations that have to work together to be able to achieve the outcomes in the settlement agreement. Does that help? Are there other details, Melody, that you?
That's perfect.
Okay.
So, if folks are interested, and I hope that there's certainly, I see some MCOs and BHASOs and providers and, community stakeholders and, on the call. And I know that there's a lot of interest in, what is happening with the Trueblood settlement. And so one, this webpage certainly, has a plethora of information. I think also DRW's website also has quite a bit of information. They also are doing quite a bit of, sort of focus groups and updates in communities as well. And so, if you're interested in, and I really encourage, MCOs, BHASOs, providers, homeless providers to be attuned to all of these things. One, there's some significant resources coming to those phase one regions, but these folks are in all of our systems. And so how do we as communities really come together to try and address this issue, address that continuum from trying to divert people from being arrested in the first place to also those folks that are coming out of jails and that need the outpatient mental health system, outpatient behavioral health system in partnership with the criminal justice or the justice system. And so all of those things are all going to have to be part of this hurricane of opportunities and collaboration that we're going to need to be able to try and address and resolve this lawsuit.
Melody, that's a great point, and that reminds me, too, that we also have a listserv. So I don't know if any of the folks on the phone have already requested to be added to the listserv, but if you send an email to that Trueblood Task Force email and ask, you can be added to the Trueblood listserv, and we send out opportunities for when we're going around to the different regions. Melody mentioned that we've made a lot of trips around the regions. We advertise those if there are folks that want to meet with us. We put that out through the listserv. We've had multiple WebExes sharing information about specific programs or components. When the bill was passed, we had a WebEx that went into detail about that. And so if you want to stay connected, that's another great way to stay connected to what's happening with the Trueblood Settlement Agreement. And again, if you just send an email to the Trueblood Task Force and say, I want to be added to the listserv, they'll get you added.
So, Amanda, it looks like Julie has her hand up.
Okay, let's see.
Not anymore.
Yeah,
Julie,
I don't see any questions. Yeah, I have the question thing open, but I don't see any new questions. I think that was from earlier.
Okay. If she had wanted to ask a question.
Yeah, I believe that was from her. I had the big question box open and ready to go anytime a new question comes through. So.
Well, Ora, thank you so much for your time today. I really appreciate partnering with you to share information about the Trueblood Settlement projects, and it is definitely a lot of moving parts, and Ora is the cat herder of all of these different projects. So
thank you, Melody. You know, it's been such a pleasure. There are so many people, I'm sure you guys know this yourselves, there are so many people who are passionate about finding solutions and who want to make things better and have great ideas. And so every day I'm surrounded by dozens of people that are so very talented and committed, and it makes herding cats much easier because I don't really have to herd cats. Everyone is totally motivated and interested in making this happen and making things better. And so it makes my job really easy.
Thank you. And, just as another FYI, we are working, with the, you'll see in the settlement agreement that there are a lot of projects, and we are working at kind of one-page descriptions, a little bit more information on each of the projects. And so hopefully in the next month or two, we'll be able to distribute a little bit deeper dive into each of these projects. But so stay tuned, and I'm sure we'll be sending an announcement out on the listserv when those one-pagers are available. But this is at least it gives you a little bit of a working knowledge about all of the projects in the settlement agreement.
Melody, have you already shared the one-pagers that have been completed that are more high-view overview of the settlement agreement? So, Amanda, I can send you the one-pagers that we have that talk about Trueblood kind of at that high level. And then those are ones that were already released through the listserv. So they probably wouldn't be re-released to the listserv. So I can send you those so that you're caught up on what what we've shared so far.
That would be great, and I can add that to the email that we send out for follow-up. That would be wonderful. Thank you.
Okay. Yeah, of course.
So one of them's on the budget, right?
Yep.
This kind of talks through each of the each of the buckets, so competency evaluation, competency restoration. So this addresses the evaluators and then this addresses the outpatient competency restoration. Crisis services is one bucket that includes the mobile crisis as well as the expansion of crisis triage and stabilization. And then we also have all of the diversion support. So this is a lot of our HARPS program, the intensive case management program. Oh, HARPS is separate. So the diversion support. Oh, this is another line item, a separate line item. The housing supports the HARPS program, the forensic navigators. So we'll make sure that you have the overview. And again, this is for the biennium for the 2 years that started July 1st, 2019 and goes through 2021. And then I think there's the other, what's the other one pager that we have?
So we have one that's kind of a general overview about the settlement agreement. Right. We have an FAQ. We have one that explains the budget differences between the money that was paid by the state to the courts for contempt funds and how the court used those funds for diversion projects versus the legislative funding that came through to support the settlement agreement. So we've had several. Yes, exactly that one.
So I will, I'll get all of these to you, Amanda, so that you can send them out with a copy of the PowerPoint.
Thank you very much.
All right. If there's no other questions, I guess we'll give people 30 minutes of their life back.
Well, thank you very much, ladies, for your presentation, and thank you, Washington State, for being available and listening and asking questions that were very important. And like Melody said, we'll give you 30 minutes of your life back, and please be watching for an email coming from me to all of you, full of wonderful information and plenty of attachments. So thank you again, Aura and Melody. We appreciate your time and all of your efforts.
Thank you so much.
Looks like we had one last question that came in from Andrea that she's asking if the budget flyer is just for the Phase 1 regions, and predominantly most of the projects are for the Phase 1 regions. I think the co-responder program is statewide, but for the most part, all of the interventions are, but you'll see in each of the descriptions for the line items.
Yeah, there's a couple that are statewide just on their nature. So like adding the evaluators and adding the beds, those aren't going to be accepting only people or working with only people from the Phase 1 regions. Those are statewide efforts. But yeah, the majority of the settlement agreement is regionally focused.
All right, Amanda, thank you so much for the opportunity to present information on Trueblood.
Thank you very much for doing so, and I hope everybody has a really great weekend. Please stay safe and enjoy the weather.
Thank you.
Thank you. Bye-bye.